is the tension pneumothorax. Here, it is another important trap in the Nclex type of questions where the air is trapped in the pleural space. It might be any one of the lung, either it is the right or the left lung, where we can see a lung is getting collapsed and the mediastinal shift is present to the opposite side. And the classic signs here are there is hypotension again, and the jugular venous distension and the tracheal deviation. This is the important sign, but this is seen a bit later. The absent breath sounds on the lung which is affected is the most important sign and associated with severe respiratory depression. And other clues which we can see is the hyperresonance on the affected side and the sudden dyspnea after a central line procedure or a trauma, or the patient is being on ventilator. So these are the important signs we have to see in tension pneumothorax. The main priority action is we have to compress by a needle immediately. The problem is air is compressing the lungs and the heart both. So the main solution is release air now. So the lungs is getting a place for its expansion. So the main Nclex trap, how we can get in comparison is, the features are the breath sounds in a cardiac tamponade. The breath sounds are clear, and in tension pneumothorax, the breath sounds are absent on the one side, which is the affected side. And the second thing is heart sounds, which is muffled in cardiac tamponade, and in tension pneumothorax, the heart sounds are absolutely normal. And a tracheal shift, there is no tracheal shift in the cardiac tamponade, and there is a tracheal shift in the pneumothorax, but it is a late sign. The recent surgery, and this is the main cause in case of cardiac tamponade in a cardiac type of cause, and tension pneumothorax, there might be a chest trauma or some central line insertion, or patient is on ventilator. The main treatment is, in cardiac tamponade it is pericardiocentesis, and in tension pneumothorax is needle decompression. These are the important things we have to keep in our mind when we are going about this type of particular questions. The important decision rule which is being monitored is, if the lung is the problem, so we have to decompress the chest by a needle decompression, and if the heart sounds are muffled, then drain the pericardium. This is the only solution. So this is the important aspects we need to monitor, and we have to go about